The purpose of the NBCC Code, well, the practice of professional counseling is governed by boards and regulatory agencies, and to practice both ethically and competently, we as counselors must be knowledgeable about all of that. So today we're looking at the ethics of practice and how to apply the Code of Ethics with the minimum ethical behaviors. We will accomplish this as we look at some common scenarios of the counseling practice. The main reason for the code is to establish guidelines and to present an enforceable set of directives for protection of the public, which serves both us as counselors and our clients. The guidelines of the Code of Ethics are important because we rely on them to provide guidance and understanding and application of ethical principles for our clinical practice. This guidance also ensures that our clients are provided with a fair method for complaints. Of course, we don't think they'll ever have complaints about us though, right? And appropriate handling when something goes wrong, sometimes it does, and to give our clients a fair method of handling complaints or problems. So that's part of what the Code of Ethics is all about. And this is protection to the public, and it guides our choices to do no harm. Ethics is a branch of philosophy that tries to answer the basic question, what should I do? So I like this quote as it fits for today's presentation. Ethics is knowing the difference between what you have the right to do and what is right to do. Because sometimes we have a right to do certain things, but it might not be the right thing to do for that client. So first, when that happens, we might need to use an ethical decision-making model. So to answer these questions, when there is a dilemma, it really comes from our values and our principles and our purpose. And sometimes we need this ethical decision-making model to guide us to make the decisions that are best for everyone that's involved. Ethical decision-making for counselors involves adhering to the professional code of ethics and standards while navigating complex situations involving clients. When we're faced with an ethical dilemma and we're trying to balance the ethical, the legal, and the moral aspects of a situation, it calls up our values and our morals. And using an ethical decision-making process can help us to obtain the best outcome for our clients. As counselors, we are to assess potential risks, consult with colleagues, maintain confidentiality, and prioritize the well-being of our clients when we're doing all of this. Decisions are usually made following a rule, such as a law or a code or a rule, or maybe the decision is made based on caring for the client, or like the golden rule, to do unto others as we would have them do unto you. And decisions are sometimes made with an outcome in mind. What will bring the greatest good to the greatest amount of people? This decision usually brings the least amount of harm. Asking the right questions and using evidence-based assessments can really help with that. Bottom line is the Code of Ethics does not make the decision, we do as counselors. So I'm going to provide a scenario to start with. I'm going to call it the eating disorder dilemma. Lucinda's a clinical counselor, and she's been doing it for 20 years, and she's treating Mindy. And Mindy's a 30-year-old female with 2 children. So she's treating her for depression. Mindy's involved in a divorce and is having difficulty managing her emotions. On the 6th visit, Mindy informed Lucinda that she believes she has an eating disorder. Lucinda does not have experience treating eating disorders, and she's concerned. What should she do? So using this ethical decision-making model, and you'll probably recognize part of it because it was taken from Robert's 7-stage crisis theory and adapted for us. So we'll look at this. The first step is deciding what type of dilemma we're facing. Is it ethical? Is it legal? Is it moral? Then we have to decide how to find a solution to the problem so that we have a better understanding of where to look. We're looking at the law, we're looking at the Code of Ethics, or we're looking within ourselves. When it's a legal dilemma, we look towards the legal system. If it's ethical, we find the appropriate code to apply. Is it moral? This is where we reflect on our personal values and principles to ensure alignment with the ethical standards outlined in the code. But by integrating personal morals with the Code of Ethics, we can evaluate our actions and decisions with both professional standards and our own values, which is practicing with integrity and ethical conduct as we uphold those principles. So some define morals as standards, and this can either complicate our decision or make it simple. We know that this comes from the individual, societal, and religious values, and these morals can guide our choices. However, ethics is a lot more than one set of morals or a specific religion, we also need to consider morals, which are somewhat standards that we live by, and what they do change over time, actually, and will continue to change over time. You know, less than 50 years ago, girls were not allowed to wear pants to school. I was one of those girls. You could not wear pants to school. And if you wore a dress or skirt that wasn't an appropriate length, you would be sent home. Police women used to wear dresses when they worked. This is not the case today, and society has a different set of beliefs about expressing individuality and freedom. So many people inherit their moral standards and their stance from their family, some from the community, and from culture. And it's rare for somebody to shop around for the morality that fits their personal beliefs, right? And we might live our whole entire lives under a moral system, and maybe if we'd had a chance to think about it, we'd have chosen a different moral standard. All this to say, sometimes it's a wise decision to use an ethical decision-making model to ensure that we're making the best decision for the greater outcome for everyone involved. Guiding principles can bring some things to the surface as we reflect on them. So I have these guiding principles that I found that I think are so helpful when we're going through the ethical decision-making model. We decided what's ethical, legal, or moral. We've decided on some solutions that might help. We've evaluated each solution. It's really good to evaluate by using these guiding principles, and then we might need to consult and then choose the option that's going to give us the best result. So these guiding principles are: is this action fair that we've chosen? Would you recommend it to a peer? Would you feel if this decision was known by others or came to the attention of the public? Would you want this course of action applied to you or someone you care about? And what would others you respect or admire do in this situation? I used to put, what would your mother say? But then I had somebody in a seminar once say, I don't really care what my mother says. So I changed it to, what would others you respect or admire do in this situation? Are there any lingering feelings of uncertainty, concern, doubt, or uneasiness other than what might be considered normal? Because that can change your mind about how you're going to handle that. And then you want to document the steps taken and the rationale for the choices that you made. But let's go back and let's look at this. Okay, so Mindy is being seen for depression, and now you find out she has an eating disorder. So let's go to the code. Let's go here. What is the problem? Is it ethical, legal, or moral? And what exactly is the problem? Ethical, for not being trained. Okay, I agree. So competency is an issue here. Ethical, so most of you are saying ethical. Outside the scope, yes. Ethical, okay, we got this. All right, thank you. All right, we got enough for that one. Thank you so much. Yes, I would say competency. So let's talk about that. So what are some solutions that would solve that problem? What are we going to do? There are different solutions, aren't there? So let's decide, maybe, what if someone decides, okay, I'm going to refer her to somebody else that has more experience with eating disorders. Then when we evaluate this choice, let's look at the questions. Let's evaluate with the questions, the guiding principles. Is this action fair if we transfer to someone else? Maybe, maybe not. It's going to depend on some other things that we need. But we're not talking about how to treat eating disorders. I'm just showing you how to use the ethical decision-making model. So if we transfer her to somebody else, there could be some negatives and some positives. Negative could be that she feels abandoned and maybe she doesn't go to the other person and then she doesn't get the help she needs. Positive is that she does go to the other person and gets somebody that treats depression and eating disorders, and she's good with that. We have to ask more questions to figure out if that's going to work for this person, right? Okay, would you recommend this action to a peer? Maybe, maybe not. How would you feel if this decision were known by others or came to the attention of the public? I guess it would depend on how it turned out, really, because there's abandonment to consider, and harm if she doesn't get the counseling. What would you want this course of action? Would you want this applied to someone you love, like your daughter or your son, if they had an eating disorder and they like their therapist, you finally got them to go, and now they're going to be referred to somebody else? Maybe not. What would others you respect or admire do? I'm not sure, but I still have some lingering feelings of uncertainty or doubt. So I'm going to go back and use another option here. Let me try another solution and evaluate that choice. Maybe I'll get consultation. I'll send her to a doctor. refer her to a doctor to make sure the eating disorder is taken care of physiologically. And then I know somebody I can consult with that specializes in treating eating disorders. I can continue to treat her for depression. I can talk to this person and see, maybe we can start down that route. So then you look at the guiding principles. Is the action fair? It possibly could be a little more fair than the other choice. And what would you recommend this action to appear? Probably. How would you feel if this was known by others? Okay, if it turns out, great. Would you want this course of action applied to your child? Yes, because they'd probably be more happy with that. What would others you respect or admire do? Not sure, but I don't have any lingering feelings of uncertainty, concern, or doubt about my decision because I think I'm surrounded by the right help. So I think I'm going to go with that route. So that is how you work through this ethical decision-making model. And then let's go to the documentation here. Documentation is really important. As a person who's worked in the legal system at the same time that I'm working in counseling, I know that things can't come up and problems can come from a person that you didn't even think would cause a problem. So it's always best to document, because we know there are some personalities that will make something right, take something right and make it sound wrong. So if we have good documentation and our rationale for why we made our choices, when we have to make a difficult decision, that's going to help us and back us up for sure. Documentation can deter legal action and investigations if ever called to present information on why you decided, because when you show all that you did to make the best decision, and it shows that any reasonable person would consider that you did the best you could, that will generally work out for you, according to past cases and research. So documentation is a good thing. In any moment of decision, the best thing you can do is the right thing. And the right thing can come from different places, can't it?